Fever in a neutropenic patient is actually a very small topic, and I, Dr. Ignacio Skoll, am going to present about it. Welcome to Dr. Ignacio Skoll's medical tutorial. We'll be learning about fever in a neutropenic patient today. So what does a fever in a neutropenic patient mean? So first of all, there should be neutropenia, that is decreased amount of neutrophils, and second of all, there should be fever. So neutrophil count should be less than 0.5 into 10 to the power 9 per liter, and the single axillary temperature should be less than 38.5 degrees Celsius or 3 recordings above 38 degrees Celsius over a 12-hour period. And as we know, infection risk increases progressively as the neutrophil count drops below 1 into 10 to the power 9 per liter. So what are the causes of neutropenia? In which conditions does the neutrophil count decrease? In most of the bacterial conditions, neutrophil count increase, but in some like salmonella, and some viral infection and protozoal infection like malaria, neutrophil count decrease. Drugs like antithyroid drugs, anticonvulsant, antidepressants, antimalarials, captopril, enalapril, as to antihistaminics, autoimmune disorders like connective tissue disease, alcohol, bone marrow infiltration due to leukemia or myelodysplasia, and congenital causes like Cosman syndrome, and constitutional cause like Afro-Caribbean and Middle Eastern descent. These all can be cause of neutropenia. The treatment option is very simple. So at first, empirical broad-spectrum antimicrobial therapy is commenced, and culture are also obtained. Broad-spectrum penicillin such as piperacillin, tazobactam IV can be used. Addition of aminoglycoside is not needed. And if after 5 days this has not resolved, we can use empirical antifungal therapy with caspofungin. Another equally important alternative is we can use azole prophylaxis in high-risk patients, or we can send for markers of fungal infection like galactomannan or fungal PCR.